Good day, viewers. I am Dr. Hisham Mohammed Sinari. Today we are going to create a video to discuss a very important topic, which is breast cancer. It's been shown in Ghana that we have lots of cases that occurs annually. Approximately about 4,000 cases of breast cancer occurs annually, and about half of these cases die annually. So that becomes a very big issue and a very important topic. So breast cancer, of course, mostly affects women than in men, although it can affect men, but it's mainly seen in women. And we have various types of breast cancers. So some risk factors that increases the chances of a breast cancer, some of them, or the main one we have, is family history. So the family history basically means in a female's family, if you have some of her first degree relatives that have developed breast cancer before. Example, maybe the mother, the auntie, or the sister developing a breast cancer can also predispose one to developing breast cancer in the future. The other risk factor is the age. As a woman ages, which is around the age of 45 to 50, there are increased chances of developing breast cancer. The other one has to do with hormonal reasons. So a female who has had her period or her menstruation, which started before the age or around the age of 11 or 12, and then she had menopause at a very late age, has had an increased exposure to what we call estrogen, and that can also predispose her to develop breast cancer. Some other lifestyle modifications or some lifestyle reasons are also predisposing women to breast cancer. One of them is smoking, the other is alcohol intake, and then obesity has also been shown to increase chances of breast cancer. Breast cancer has a wide range of symptoms, but it can be asymptomatic, which means that it can present without any symptoms. So that is why the screening for breast cancer becomes very important. One of the main symptoms breast cancer can show with or can present with is a feeling of a lump in the breast. And that lump is mostly painless. So we call it a painless lump in the breast. So the female feels a painless lump in the breast. We'll quickly have to present to the hospital for further investigation and examinations. Another sign or symptom that can occur is changes with the size of the breast or the shape of the breast. Another sign that can occur, apart from the size and the shape of the breast, is that the cancer itself can spread to so many areas. So the cancer can affect the breast, and it can also what we call metastasize to so many areas in the body. Some organs that the cancer can affect is the brain. The other one is the liver. The cancer can also spread to the chest and affect the lungs. And then it can spread even to the bones and to the spinal cord of the person. So that becomes very, very deadly. So that is why we're creating this video, to create an awareness and then to show that the breast cancer is there, and then there has to be a screening that has been done from time to time to be able to detect it, because most of the cases are asymptomatic, which means it doesn't present with a symptom. Some of the investigations we do in the hospital, once we get a case of a suspected breast cancer, the first thing we do is to examine the patient clinically. So we palpate over the breast and we get to where the lump is, and we try to characterize the lump, looking at the size of it and the features of the lump. Other investigations we can do is an ultrasound, which will tell us how the lump is. The other investigation we can also do is a mammogram, which is basically an X-ray of the breast, and it will further describe what the lump is. Some other investigations are some other blood works we can do to find out if there's any other issues that could be causing the lump in the breast. Some treatment modalities for breast cancer include surgery. So if the breast cancer is at an early stage, most doctors will advocate that it is removed surgically to prevent any spread of the cancer. Other forms of treatment can be chemotherapy and radiotherapy, which is done giving medications to kill the cancer cells present in the breast. So this is a very important topic, and the main thing about this is about the screening. Screening is very important because that's the main way we can detect the cancer early. Because once it is detected early, there are so many treatments which can be curative. But once the cancer spreads to so many parts of the body, it becomes a terminal case and it's very difficult to treat. So I advocate that we come to the hospital, especially in this month of October, which is a breast cancer awareness month, for screening and examination. Thank you very much. I'm Dr. Hisham Mohammed Sinari.